Bernie Madoff accounting a gigantic disaster?
Well, you know, listen, Carl and the Republicans would be familiar with that, since under their leadership, they took us from big budget surpluses at the beginning of the last decade to a $1.3 trillion deficit by not paying for things like the prescription drug plan, 2 wars, big tax cuts. So no, this is the Congressional Budget Office is very clear. Over the next 2 decades, this is going to cut the deficit by over $1 trillion. Over $1 trillion.
It only cuts the deficit. It only cuts the deficit if you double count, as you double count $53 billion worth of Social Security payroll taxes twice. If you double count $500 billion in Medicare cuts twice. Once for reducing the cost of the $38 trillion unfunded liability in Medicare, and at the same time for the current expenditures of this program. And if you double count $72 trillion in premium payments for a new long-term care entitlement program twice, once for the premium payments for the program and once for this. Look, you have run up more deficit before this bill in the first 20 months and 11 days of your term in office than was done in the entire Bush years. Your plan is to take the deficits, which were 2% under George W. Bush, to 5.1% over the next 10 years under Barack Obama. Don't be lecturing us about what you're doing with the profligate spending that started last year with the failed stimulus bill and continued with your budget increases. You have just increased the discretionary domestic spending budget of the United States 25% starting in the middle of the last fiscal year. This is $2.4 trillion in cost for its first 10 years, and the country cannot afford it, and you will bankrupt the country if this bill passes.
I think Carl's against this bill, but isn't there a point, though? I mean, there is some interesting accounting here. I mean, the Medicare doc fix, for instance, is not in here. That's a couple $100 billion. I mean, isn't it hard as a political factor for people to believe that a big new health care program is actually going to cut the deficit?
Well, first of all, Carl, the Republicans have zero credibility, about as much credibility as the country of Greece does, to talk about fiscal responsibility.
This is the CBO.
Carl,
these numbers are in the analysis from the CBO. For God's sake, will you stop throwing around epithets and deal with the facts for once, David?
Carl,
deal with these facts, David. What about double counting?
What
are you doing about that double counting?
Let's give him a chance to answer.
I'm trying to. The CBO, major economists who've looked at this health care reform, very clear that this in this decade is going to lower the deficit, and then in the next decade, over $1 trillion. What the American people are focused on, what we need to be focused on, are the health care costs, premiums skyrocketing. We saw recently health insurers threatening to raise insurance rates 30, 40% on individuals, small businesses being bankrupted, not be able to provide care. It's obviously devastating our federal budget situation. We are not going to solve these problems unless we have meaningful health insurance reform, and that's what we're going to do. And listen, the Republican Party, if they want to run in this election and the elections of this next decade, against reducing the deficit by over $1 trillion, against the insurance company reforms, against saving money, we're happy to have that debate.
Within 2 months, the Democrat Congress is going to be forced to deal with the doc fix. They're going to bring up a Medicare doc fix that's going to be $208 billion, according to a CBO analysis of it issued 2 days ago. We will see very soon how much they're committed to fiscal discipline when they pass a doc fix without an offset that adds $208 billion to the deficit. And when we start to see them continue to double count, I like it that David never dealt with the issue of double counting and never dealt with these other issues. We will see if they pass this bill. I hope they don't. I pray they don't. It will be an economic disaster for the country if they do.